Welcome to Health Source of Flushing, New York. Today's topic, chiropractic treatment of sports injuries. With the increasing large numbers of people who participate in all forms of sports, unfortunately, sports injuries are common occurrences. People sometimes choose to go to chiropractors after they have suffered sports injuries. What is a chiropractor? Chiropractors, who are also referred to as doctors of chiropractic medicine or chiropractic physicians, take a holistic approach to the health care of their patients, providing drug-free, non-surgical, and non-invasive treatments that work with the body's natural ability to heal itself. Chiropractors address problems of the musculoskeletal system and their impacts on the body's nervous system and the patient's overall health. Along with the more general aspects of their practice, chiropractors often specialize in nutrition, rehabilitation, physical therapy, orthopedics, or sports injuries. How do chiropractors help with sports injuries? Chiropractors look at the human body as an integrated system, but their main areas of focus are on the spine, joints, muscles and tendons, ligaments, and nerves. They use their hands to give adjustments to the spine and surrounding joints when they are out of alignment. Chiropractors provide drug-free, non-surgical treatment for many kinds of injuries such as sprains, pulled muscles, and bursitis, along with joint problems that are not necessarily caused by injuries such as joint pain in the shoulders, elbows, wrists, hands, hips, ankles, and feet. One of the added benefits of chiropractic care is the preventative aspects of the practice. An athlete who visits a chiropractor on a regular basis getting adjustments and receiving holistic care of their body can help prevent some injuries because their body is in peak health and condition. Sports injuries often fall into two major categories. 1. Traumatic injury from a fall or a collision. And 2. Overuse or repetitive stress injuries. Traumatic injuries often cause damage to the connective tissues or ligaments in the form of fractures or dislocations. These injuries can vary from a pulled muscle or twisted ankle to a more serious injury that requires surgery. It's crucial that strains are properly cared for soon after the injury occurs in order to make sure that the injury heals properly, lowering the risk of a future disability. Overuse injuries. These injuries occur when people are involved with a repetitive activity such as running, playing golf, tennis, or bowling. Over time, a slight strain to the muscle or tendons can have a cumulative effect, causing discomfort from stiffness, pain, and eventually the inability to move the affected area. Athletes and those who are physically active might want to remember a simple mnemonic, PRICE, when it comes to taking care of strains and sprains and soft tissue injuries. Protection. After the injury has occurred, protect the injured part from further damage. Rest. For a minor injury, a rest period as little as 24 hours may be appropriate. More severe injuries will require longer periods of rest as advised by your doctor. Ice. Apply ice within the first 24 hours of the injury to reduce the swelling. Never apply the ice directly to the skin, but use a towel to wrap the bag of ice first. Limit the use of ice to 20 minutes or less. Compression. Using an elastic bandage to wrap the strained joint can help reduce swelling and bleeding in the injured area. Elevation. Elevating the injured area so that it is above the heart immediately following the injury helps to minimize the swelling, and this can also reduce the pain a bit. If you are suffering from the effects of sports injuries and you'd like to find drug-free, non-surgical treatment options, please visit a chiropractor to learn more about the benefits of chiropractic care. To find out more information on topics like this, please go to healthsourceofflushing.com.